You know how all the big prepping channels have the clickbait? Watch this video, your life might depend on it. Well, that's true about this video. Your life really might depend on it, or the life of your loved ones. I'm going to share with you something that I do that I think is extremely important, and I want to encourage everyone else to do it too. And that is to keep a printed healthcare summary. Now, first I'm going to go into what could happen, why you might need it, and then I'll go into what you need to have in that healthcare summary, and I'll share you some of mine. Now, in a past video, I said, cyber attacks have really been increasing. They've been hitting healthcare systems, and when they do, electronic medical records might not come up. They might not be able to get results on various technology, the machines that they're using. It can cause all kinds of havoc. I think it was last year in Las Vegas, the big health system there got hit, and they decided they're not going to pay that ransomware. And I think it took them 23 days to rebuild all the healthcare information. But they did it. But what happens if you need help or care in that 23 days? Well, if you have this healthcare summary, you'd be in luck. The other thing is, and this isn't a disaster for once, one of the reasons you need this is travel. Yeah, you might travel to another state, another country, and they don't have access to your digital record, or it's going to take some time to get access. In that case, something like this, a healthcare summary, could come in really important. The other thing is, most healthcare systems and providers now have electronic medical records. And during Obama, when he was president, they gave an incentive to systems and healthcare providers to go on electronic medical records. They gave them some money if they could qualify. That was the carrot, but then a stick came. If you didn't go on it, you're going to get paid less for your Medicare. So most of all the large systems and many providers are on electronic medical records, which sounds great because it's supposed to reduce errors, right? Well, to me, it's just changed errors maybe. I own a medical billing company and we work on a lot of different EMRs. Our local hospitals all seem to use Epic. And we often find we're looking at a record and for a patient and we go, well, wait a minute, that test has a different patient's name. So what's happened? Some staff person has scanned results into the wrong electronic medical record. So human error still happens. It just happens a little bit differently, right? And that person might need help. They're at the hospital. The provider's looking quick at what those lab results are and don't even notice that it's not the same name as the patient, and that patient's life could be in danger. And according to a USA Today article, electronic health records are supposed to reduce medical errors in hospitals, but they fail to detect up to 33%. Wow. So, having something like this, again, important. Now, if you are experiencing maybe a cancer diagnosis or a serious health ailment, you may want to have a whole binder of information, not just one sheet, where you're keeping all your records and you're going to know what's happening to you and you're going to be your own healthcare advocate. It's very important. So in that case, you might want to keep a binder of information and you take it with you wherever you go. So I have a one sheet, both sides, that I do my healthcare summary on, and I update it as needed. And really, it gives all the important information at a glance. So this could be used if I'm traveling or I can give it to a loved one. If I am unresponsive, they can answer certain questions about my healthcare, what prescriptions I'm on, that type of thing. It really comes in handy. Now, of course, at the top of this, I have my name, my birth date, my address, my cell number, my emergency contact, which is my husband and his cell number, and of course, my health insurance and my health insurance ID number. And then I list my primary care physician's name and number and any specialist that I routinely see. So in my case, that would be a dermatologist I see about every year or two, and my ophthalmologist. But you might have other specialists you're seeing, so you list their name and the contact information. Next, something that's very important, you might want to put it in bigger letters or in red, allergies. If you're allergic to any medication, state it. Very, very important. Every year people die because they're given the wrong medication that a person is allergic to. So that's important. Then you want to list your prescriptions, your dosage, and the reason you're taking them. And I'll share you mine in this. I am on thyroid medication, 100 mcgs, and I have a topical that is sometimes used for a skin yeast infection, and another topical ointment that I use if I'm having a psoriasis outbreak. And that's it. But you might have other medications, so your list might be much longer. You also, though, want to list any vitamins and supplements you're on. In my case, I'm only taking vitamin D, and I put down the dosage. And I take it because I've had a vitamin D deficiency. So again, list your vitamins and supplements. That's very important. Next thing that's important, what are your ailments? What's your diagnoses? So again, I'll share you mine. That's fine. I have Hashimoto's hypothyroidism. I sometimes suffer from diverticulitis. Sometimes I have an outbreak of gouty psoriasis, acid reflux, a small hiatal hernia, Gilbert syndrome, vitiligo, and a year ago I had acute pancreatitis, which resulted in my gallbladder being removed. So that brings up a good point. Always list what surgeries you've had and the date you've had them. That's also important information. And you may want to list the surgeon's name also. Then, your vaccination record. And I'm not just talking about your COVID shots here. Your Tdap, if you've had shingles, any other vaccinations you might have. Then, of course, that's really important if you're doing this for family members such as children. And I've went out of this country, so I've had typhoid and yellow fever vaccinations too. So you want to list everything and the date you had them. You might want to keep blood pressure records, especially if that is a problem, the date you took it and what the results were. And I think it's a good idea also to list your dentist and their number on this, and any dental implants, bridge work, dentures, that type of thing that you might have. And that's it for the front page. Now let's go to the back page. Well, on the back page, I think it's important to keep track of tests that you've had. Your mammograms, your bone density, colonoscopies, those lovely, lovely tests. Put the date that you've had them and the findings. And when I say the findings, I don't mean that long, long report that you get back, right? I just mean like mammogram, normal, okay? Or maybe in this case, when I was having my pancreatitis problems, I had a CT abdomen and pelvis without IV contrast, I think. And I summarized acute diverticulitis, cholelithiasis. Oh, anyway, it's the gallbladder problem. Small hiatal hernia and 4 mm pulmonary nodule. Okay? So it's right there. Everything's there. I have the test, the date, and the findings. And if you've had some less than optimum findings, again, then you might want to also keep those with the sheet for reference. And then something I do is I keep track of the lab values that are important to me. So here, let's look at this. I have the value here, what is normal, and then I have my dates all the way across. And I actually, on mine go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I have 10 years worth of data that I keep and compare. So I can say, hey, oops, I'm not doing too good on that one, or I'm doing better on that one. But it gives me a picture. I think that's really important. And as you can see here, I'm sharing my last one with you. Not doing too bad, actually. I put a color in when I'm not exactly in the normal range, but I do this so I can compare my results. And again, give this to a healthcare provider if they didn't have it, and they can see what my norms are. So if something is totally unusual, they have historical comparison. And then on that reverse side, on the bottom, I have a copy of my insurance card. And that's it. Pretty simple, but it gives you a great snapshot of my health and my history. Very easy. You just want to keep it up to date. You should have one for each family member. You want to keep one in a grab and go binder, which is something I think is so important. I have a video on it, but I keep a copy in my grab and go binder. I also keep a copy in my car, and I let a loved one have it just in case I wasn't responsive. And with this, you'd want to give them a copy of your advance directive. Very, very important. And once you do this, it's really easy to keep it up to date. Now, if you'd like a template of my health summary sheet, you can email me at prepperpotpourri@gmail.com, and I will email it to you. It's just a template, nothing fancy, but it should help you organize your important medical information. Now, I want to tell you there's one other thing you should do. Not just do this, but also check your electronic medical record information. You know, a lot of times you can go into something called My Chart or something like that and review the information. Is it accurate? Are those the prescriptions you're taking? Very, very important, because that information can follow you from provider to provider, and if there's something wrong, that will also follow. So, do a healthcare summary and check your electronic medical record. Your life or your family's life may depend on it. As always, thank you so much for listening, and I hope you subscribe and share the knowledge. Stay healthy.